Okay. Well, it's my pleasure to introduce our speakers that we have this afternoon. Very, very excited. And we have with us first, Sharita Chambers is a transformational healthcare leader with 30 years of nursing and healthcare leadership experience. She has extensive clinical practice and operational leadership experience in various acute care settings across the GTA, serving in various roles including advanced practice clinical educator, clinical nurse specialist, clinical manager, and in director roles in both academic health science centers and large community-based teaching hospitals. Wow, that is amazing. She holds a Master's of Science in Nursing in Clinical and Administrative Leadership and is currently pursuing a PhD in nursing with a focus on healthcare and nursing leadership and staff engagement. Sharita is known for her demonstrated proficiency in change management and is highly skilled at achieving results in advancing nursing practice and in fostering a collaborative, interprofessional approach to patient care. In her current role as a Director of Nursing Practice Innovations, Sharita is committed to ensuring alignment of clinical nursing practice with organizational wide priorities, such as CAMH's vision, mission, and strategic direction. Sharita holds a lecture position at Lawrence S. Bloomberg Faculty of Nursing, University of Toronto, and works closely with internal and external partners, promoting and fostering excellent in nursing standards and practice, academic excellence, and scholar. Sharita is driven by her passion for mentoring, coaching, and developing others, enabling individuals to reach their full potential. Sharita is the recipient of many awards for clinical excellence and recently received the 2023 Sue Matthews Mentorship Award from the Nursing Leadership Network of Ontario, and a recent winner of the 2024 Registered Nurses Foundation of Ontario Legacy Award for Nursing Leadership. That is wonderful, Sharita. It's great to have you with us, and thank you for your presentation to come this afternoon. I know it's going to be just amazing. And we also have Sharhisa Jindani, is a registered nurse and has completed her master's in public health from the University of Waterloo. She has been at CAMH for 10 years, working in various outpatient and inpatient settings with a focus on early intervention. After completing her master's degree, she became a nurse educator and supported the crisis and critical care units. She then supported the patient safety quality team as a patient safety specialist before starting her current position as an advanced practice clinical lead for the implementation of RNAO's best practice guidelines at CAMH. She holds a lecture position at Lawrence's Bloomberg Faculty of Nursing, University of Toronto. You ladies are busy, and we're so grateful that you have taken your time to prepare this amazing presentation and share your expertise and your passions. I love through your bios how you really display the passions that you have, and I am now going to hand it over to you. Thank you.
Thank you.
So, thank you all so much. As mentioned, I am Sharita Chambers. I am the Director of Nursing Practice and Innovation at CAMH. And, I thank you all for attending this champion engagement session. I count it a privilege to share our journey with you. So as you heard, I'm the Director of Nursing Professional Practice and Innovation at CAMH. And in my portfolio, we lead the best practice implementation and support the work of best practice, achieving BPSO. And we're busy with engagement across the organization. It really is the engine that drives success of achieving BPSO. I also want to mention that our executive sponsor is Dion Sinclair. Dion is our Vice President of Clinical programs, and she's the chief nursing executive. I report directly into Dion. She's my direct boss. So for our agenda today, I want to just walk us through a little bit of CAMH's background, just to give you context of the work that we do at CAMH and who we are. Saharish will be walking you through our journey of champion engagement. She'll be discussing what enables success, how collaboration really drives this work as well, our champion engagement outcomes. She'll talk a little bit about all the initiatives that we've engaged in. And then a little bit of discussion on lessons learned. Next slide. So who are we? The Center for Addiction and Mental Health, CAMH as for short, and as everyone knows us, is Canada's largest academic mental health hospital and one of the world's leading research centers in mental health and addiction. And we just wanted to share a little bit about who we are, about our people. We have just over 4,000 staff, 414 physicians, including psychiatrists and medicine doctors, hospitalists, 350 volunteers who support our patients. We see over 2,000 students per year, 275 champions that are engaged in this work of implementation. And at CAMH, our community, we serve 118 patients and 118 inpatients, sorry, and outpatient programs. That's our capacity here at CAMH. Over 40,405 patients served, 16,000 emergency department visits, and this keeps growing since we opened our emergency department. And we have over 83,000 virtual care visits at CAMH. So we are busy, and we are the largest mental health institution in Canada. So at CAMH, we implemented 5 best practice guidelines that were aligned with our strategic priorities. And at CAMH, our strategic plan priorities to advance care, to get upstream, and to lift societal health. And we understood that best practice guideline implementation or achieving BPSO status really enhanced that work of advancing care and getting upstream. At CAMH, we also aligned our work with our quality improvement plan, so our quality focus around patient safety. And I just wanted to flag the guidelines that we implemented at CAMH. We chose patient and person and family-centered care as a foundational guideline. It really frames all of the work that we do here at CAMH. Our first guideline we implemented was promoting safety, alternative approach to restraints, transitions in care, delirium, dementia, depression, engaging patients with substance use. And we chose those guidelines because not only do they align with our strategic priorities, but they were aligned with various program work that we do. And our success really centered around engagement. I want to talk just really quickly about how we engaged. Our executive leadership prior to implementation, we started with engaging executive leadership, our clinical leadership, our clinical managers. So we went through all levels of engagement, because you can't have champion engagement without the support of the whole organization and everyone understanding the work that we're about to undertake. And so I will hand it over to Saharish just to walk you through our journey, as she'll be doing most of the talking here today. Saharish is our she's our best practice implementation lead and a phenomenal champion. Go ahead, Saharish.
Thanks, Sharita, and thank you so much for being here during your lunch hours. So we just wanted to kind of take you on a journey that we had for champion engagement. And I think one of the important things that Sharita mentioned is the way that we've engaged the organization has been on a combined grassroots and a top-down approach. And, we've learned that throughout our years as being nurses and as being staff, that sometimes a lot of information comes from the top down just because of organizational priorities and values and things that we need to accomplish. But sometimes that piece of frontline engagement or frontline voice, understanding why we do certain things and kind of how we involve the people on the ground that really do the work, that gets missed at some, depending on different projects. So we wanted to have a combined approach where we had the champions sit at the decision-making table, tell us what their concerns are, what their issues are, get them to come up with the solution as well. Because sometimes, we're really good at coming up with problems, but how do we come up with solutions to make it better, to make it more effective for clinical priorities? But sometimes also, this is not enough. You need leadership support just because of time, because of capacity, because of money. And again, as an organization that is leading such a big project, they need to be aware of what we're doing so they are in support and aligned with us. So it's been a journey where we've kind of done a combination approach, and we felt that it's been effective and successful. So we started in 2023, where we had our best practice guideline implementation launch. We had the RNAO team, the leadership, come and kind of introduce what best practices are, RNAO, what does it mean to be a designate, and how does it align with CAMH and why we picked the guidelines that we did. We had CAMH leadership also come and kind of speak to staff as well. And this happened at the Nursing Practice Advisory Council that happens every month and a half. So it was a great opportunity because we had the audience. We also invited the rest of the organization to attend that event. So that was our official launch in November 2023. After that, from that launch to then mid 2020 and continuous actually, because we're still working on this, but it's the champion engagement strategy was created. We used to be a best practice champion organization. We used to be a BPSO, and there was a lot of work already put into place by many CAMH colleagues on how do we engage frontline staff. So we kind of took that approach, but kind of made it our own as well. And so, we went around recruiting staff on the unit. They have huddles, team reviews. So we went, and each of the guidelines that Sharita mentioned has best practice guideline leads. So leads are people in sort of mid-leadership position, either nurse educator or advanced practice clinicians, who came with me to speak to unit staff and managers to talk about what it means to be a champion, why is it important, and how staff can support. We are recruiting at orientation. So every 2 weeks we have orientation where I present to the new staff on champion engagement and encourage them to be part of the network. Again, as mentioned, we've been engaging through leadership, so really engaging our APCLs, our advanced practice clinicians, nurse educators, managers, making sure that they know what we're doing so they can also support their staff. Marketing, I think a big thing that, RNAO talks about a lot, Doris talks about a lot, is public visibility. So how do we put RNAO on the forefront of CAMH, but also then encourage staff to understand how it aligns with their work? Because I think what I've learned is that, we might have an idea on how we want this to look, but it has to make sense for the staff, for the champions. It has to kind of integrate with their own goals and their own clinical priorities. So what does it mean to them while we're also accomplishing our goals of engagement of champions? As mentioned, it's incorporated into our organizational priorities, such as our quality improvement plan. So every quarter, I believe it is, or every year, we kind of report on our numbers in terms of how much efforts we've done for our first guideline, because it is something that we present to leadership, but it also is something that is shared externally. So other members outside of CAMH also see the work that we've done. So that was a big alignment, and I think it kind of put our work on the leadership's agenda, that this is something that the organization is doing, and to support it, because it's not only helping them, it's helping the organization. So that tie was really important as well. We have champion boards, so we call them champion corners on the unit, where staff kind of put up information, flyers. It's a little space for them to kind of be more creative, but also for other colleagues to see and ask questions as a way to engage and collaborate with other members of the unit. We have our newsletters that we share every month, and we used to have a really long newsletters, and I realized that people don't like to read a lot lot, and obviously emails are in abundance. So we've kind of made it into a one pager. So it's very quick, important information. We talk about any new updates, any new events that we're having, just a way to keep people more engaged. We're working on an external website for, so we have internal, which is our SharePoint, but also external to let other people know the work that we're doing. Because I remember that when I was first starting, I looked through a lot of different websites to see how others have accomplished. So, being a global mental health BPSO, this allows us to kind of give back to others who are thinking of becoming a BPSO. We have our steering committees, which include all our best practice guideline leads. And then we have our advisory committee, which includes clinical and organizational directors, because we know that collaboration, working with others and other stakeholders is quite important, because through this, we've learned about other initiatives happening, but also getting their support in the initiatives that we have. Recruiting our nursing resource team staff. They're actually one of our biggest cohort of staff that we have, because they kind of go on every unit as well. So it's really important to have their engagement. And then also recruiting clinical externs and clinical scholars. So that's kind of the way that we've engaged our organization. Our first launch of our guideline was for promoting safety, and that was done in April 2024. So that was our very first event. A lot of learnings from that event, but we invited the champions to the event. We had our professional practice leadership. And it was important to have them there, because if any conversations or concerns came from the champions, they were there to listen, and they were there to answer right in the moment. PPO and ELT, so like Dion, Shreda, has been quite important to be present. It's really important that they're present in these champion engagement events, because it makes staff feel that, we've taken the time out, and so have our leadership. And it's when they share concerns or thoughts, it kind of goes both ways. We hear and we listen, and we also provide that feedback. So it's been really, really helpful to have the leadership be present and really engage with our champions and with our staff. It was a full day session. We had our champion shirts distributed. So that was another form of sort of public visibility. We had our banners there, a lot of picture moments, and just ways for staff to feel more engaged, more supported. And the way that we did that, we had a goal that we had in mind. We knew exactly what we wanted to change, but we told the staff, because they were coming from different clinical areas, on how do you make this more effective in your clinical area. We can tell you what we need done, but we can't tell you how we want it done. So that's kind of what you decide on how you want to get it done. And then we had our next launch of the best practice guideline, which was in transitions in care and services, which was done later that year in November. So that ended up being a 4-hour champion session. We felt that, a full day was a little long. It was really hard to get staff off the unit at times. And the way that it was done a little differently, where we actually did the gap analysis with our champions. So even though we had done it prior to, we actually did it again with our champions, and we kind of had different clinical areas on a piece of paper. People took turns, they walked around, wrote about challenges, wrote about successes, things that we need to make better, things that we're doing really well that we can enhance. And then everybody kind of left with a goal at the end of the day. They put it on a sticky note. They either took the sticky note home, back with them, or they gave it to us. And then we kind of followed up that, hey, this is what the goal that you had. Let us know how what supports you need, engaging their managers, engaging their unit leadership, so that they're aware of the goal, can also be accountable for it. Because transition is an organizational wide guideline, is a priority, and transition is something that we all struggle with, but at the same time do have some good practices as well. We felt that we didn't want to come up with a specific goal. We wanted the champions to come up with their own local initiatives. And while the champions are doing their own local initiatives, we also had an organizational wide goal that we're working on behind the scenes. So this way, we're kind of getting like a dual approach for this. And just again, things that, we've already talked about, but if you look at sort of this diagram, it's like a bit of if you imagine two arrows, they're kind of coming together, because there's engagement and collaboration coming from the top and then also coming from the bottom. So this allows us to have our champions sit at the table, but also have leadership buy-in and engagement. Sharita and I have actually gone to a lot of the ELT and CLT, like our clinical leadership and executive leadership meetings. And we talked about champions. And I think our approach has always been that sitting where we're at, we don't want to talk about how much we've achieved without making sure that it's the champions who are doing the work, who are the ones actually on the ground, making this creative differences in the organization and reminding them that, how important it is for the organization when these changes are made. And they're not just happening magically, they're actually happening because there's people on the ground making it happen. So we've always made sure that champions are on the forefront. When we have our celebration sessions, we make sure that our champions are present, they are doing the presentations, and people are aware that all of this is through their efforts and through their engagement. And as we continue with our journey, one of our guidelines, and now I know the name is wrong, it's now people-centered care, and I know it's still in the works and releasing soon, but we kind of started the work on it already. We engaged our families and patients to talk about what their concerns are so that we can kind of take in what they think and then think about ways to improve it, but also bring it back to staff to let them know that, hey, this is what families and patients are thinking. Our people-centered approach launch was very similar to transition. Again, it's an organizational-wide priority. So we wanted them to think about the goals and initiatives that they want to take on locally. And we realized that, and I think most organizations probably do realize that being person-centered and family-centered is like the bread and butter of all organizations. And as healthcare staff, that's something that we strive for on an everyday basis. We can't take care of anyone without being centered towards their holistic care. So we kind of took an approach where instead of thinking about gaps or challenges, we wanted to think about successes. And what we did is we actually have these features. So we call them person and family-centered care features, where we pick either clinical and non-clinical teams. So dietary, environmental, like people that are very on the outskirts of clinical work, but actually have a big impact in clinical work and in the way that they engage with patients and staff and families, and highlight them and talk about the work that they do. How do they support families and patients, and why their presence is important? So we wanted to take turns between clinical staff and non-clinical staff and kind of do a monthly feature on our internal website so that they feel like they are heard and they are showcased, but at the same time, if there's any clinical work that is being done in different areas, letting others know that, hey, wow, this sounds really interesting. How can I do this in my own area? So finding a way to share and collaborate. And then one of the things, I think this is why the collaboration is so important, is that we were going to do the 3D guideline, pick one of the Ds. And through conversations that Sharita had with other leadership, we realized that geriatrics actually was thinking about a delirium pathway because that was a gap that existed in their program. And when this was brought up, the idea was that, hey, like we're also wanting to do a guideline for delirium or one of the Ds. How about we collaborate? And this is why it was so important to have these stakeholder connections and understanding that we need to work together and not reinvent the wheel, and why important to show the impact that when you engage BPGs and engage the BPG teams, it actually leads to really good impact. So even though the work, was done a lot through the geriatrics team, that we were involved in doing the gap analysis and understanding what the current issues are, what does the guideline recommend, what is the evidence, how do you support staff, education, patients, etc. So it was really great to work with the project team and work with the clinical leadership team. And so they actually had the education sessions for their own clinical area. And our hope is that to actually put this forward, take their education, modify it a little bit to make it more champion-centered, and kind of release it to the rest of the organization, because we do have champions from different clinical areas for this guideline, but also aging population is not, we realize that it's not just in one area, they're kind of spread across the organization. And that's one of our plans. And the other thing that we realized through the gap analysis is that we don't have education material, brochures, pamphlets, etc., for families to be handed out. So that's something, again, that came up from the conversation that we had because of that gap analysis. Additionally, throughout the year since we started, we've been attending conferences. Again, even though, Sharita or I might be part of that conference and we might be doing the presentation, the work that we showcase is our champion work. And we often recognize and make sure our champions are talked about, and people know that this is not a single effort, it's a collaborative effort. There's been abstract submission, and recently for the RNAO symposium, a few of our abstracts were actually written by our champions, and they were their names were kind of shown into the abstract to make sure that they were part of this process. And then last year we had Dr. Doris Grinspan come to CAMH, and she's coming again in August. And our sessions with her have also been where champions do our presentations, there's networking, and then we take her across the organization for a tour where she meets other nursing and allied health staff and kind of hears the work that everyone is doing. And lastly, our last guideline is on engaging clients who use substances. So things that we're doing at this point is we've chosen the clinical areas, thinking about the recommendations that we want to implement, creating a project plan, and then recruiting champions. And I think one of the things that we really appreciate is that when you're doing a guideline, and for staff as well, is that we don't have to pick every single recommendation. It's been really important to identify what works for that clinical area, and what will support the clinical area the best. And again, just a very quick sort of graphic that how have we been successful through collaboration. So this is a lot of different pictures of our different events of our champions. And we've been able to reach our BPGs and BPSO outcomes through constant communication with our staff. And I've learned through a lot of other people that over communication sometimes is better than under communication. You just never know who you reach at what email. There's, again, the grassroots approach, building relationships, seeing staff in person on the clinical units, because allied health might be able to connect with me through WebEx, but nursing staff might not because of their workload and because of the nature of their work. So kind of seeing them where they're at, engaging, letting them know about the successes. When we talk about something that I'll mention in the next slide, we let the champions know that, hey, look, we presented your work to the executive leadership, or hey, your work it's being talked about for implementation in other areas. So they are aware that their work isn't just for them, like for that unit, kind of it's getting spread across the rest of the organization. Allow them to be creative. I think sometimes, that's the best way to engage staff, to be more autonomous and to kind of really feel proud of their work, is to let them kind of run with it. Being aware of what we're doing, what they're doing, the impact of what they're doing, hopefully and allowing them to be inspired, appreciating them, and having different events for them to feel like they're part of the organizational priorities. And sometimes I think it feels a little bit siloed when they're kind of doing their own thing, but when we come together, it's quite nice for everyone to see and engage with others. And sometimes what a lot of champions say is, I want to know about other people, what other clinical areas you're doing, because our organization is really big and we have a lot of different programs. So if someone's working in forensics, it's hard for them to understand how and what maybe crisis and critical care is doing, which is a lot more acute. So putting people in spaces where they can kind of talk to each other also allows each of them to be inspired by others. Sorry. One second. And again, this is just a very quick visual representation of the different events that we've had. So I'll just start from the top, my left. This is when we had one of our, when we were doing the blended learning series. So we kind of watched the sessions together. Everyone came together and obviously tried to have as many picture ops as possible. The one at the bottom was Doris's visit last year. The one after that is our person and family-centered care engagement session with our staff. Then in the next row is our champion engagement session for transitions in care and services. Clearly, I took that with my phone, so the quality isn't the best. Then Doris came to visit one of the psychosis and recovery care treatment unit. So this is some of our champions, our leadership, and it was a really great opportunity for people to actually hear and see leadership in action, and at the same time talk about the work that they're doing. And I think that's kind of all our staff need. They just need to be appreciated. They just need to have a space to talk. So these are really great opportunities to engage champions. Then at the bottom is our initial launch that we had in 2023, and Doris wasn't able to attend, but she sent a video. So we kind of took a picture with her in the background. Then next is our promoting safety engagement session. At the bottom is the delirium education that took place for the geriatric program. We just launched or did a feature on transition services, which is a very unique service in our schizophrenia program. So because we did a feature on them, this is a picture of their team with their manager and the rest, and then there's 2 champions in that. And then at the bottom is our interprofessional collaboration event. So one of the things we learned from the champions is that, again, they want to know about other champions, other roles, other clinical areas. So we called all the different champions. We did a little bingo where people had to kind of talk to other people, get to know them. So that was one of our sessions as well. And then this is just some of our outcomes or some of the things that champions have done themselves. And again, I would say majority of it comes from them. It might just be like a little push in the right direction, but a lot of it comes through their creativity. So we launched, or we talked about doing a strength-based handover. So reminding staff or each other of patient strengths when we're doing handover at shift change. Sometimes, a lot of our handover becomes a lot more clinical and a lot more, what did the patient do wrong today? But instead, we wanted to kind of bring that focus back. Okay, what was one of the strengths that the patient showed today? And it just changes the perspective. And this was something that came up from the champions as well. At the bottom is our safety and comfort plan. So safety and comfort plan is something that is part of our documentation standard. It's a clinical priority. Every patient who comes in gets a safety and comfort plan. But what some of the champions realized in one of the forensic units is that it's hard for sometimes patients who are really unwell and sick or don't feel comfortable sharing to them to verbalize what their needs are. So they created a visual representation of what existed in the safety and comfort plan and provided that to the staff or to the patients and kind of kept a copy of it and was able to then create or document on the safety and comfort plan. So this was a really big success for that unit. Again, I know this might be really small on your screen, but when we did the person and family-centered care engagement session, we kind of gave an information sheet back to all the clinicians that attended in terms of what were some of the local successes that staff mentioned. And again, I think that was a session where we talked a lot about successes and a lot about learning from each other. There were things that people were doing that others were like, oh, this sounds really great, or I would like to implement this in my clinical area. So a lot of it was learning from each other and realizing a lot of the great work that happens across the organization that sometimes we just don't get to know about because inpatient focus and outpatients kind of doing their own thing, and they're very different. And then kind of talked about opportunities for success. And I think one thing we also learned through champion engagement is that making people-centered care kind of like an umbrella. So instead of it being a separate thing, how do we integrate it into our everyday practice and make it something that we do without it being like a priority? Like it's just something that's automatic for all of us, not just for staff, but for physicians, clinical, executive leadership, and I think I said physicians. The next is a CAMH and BPS is sort of like a collaboration effort that, again, the forensic team made for one of their presentations for Nursing Week, where we invited them to a panel discussion. We have a lot of, again, we work with restraints, though we reduce a lot of our restraints. There's a lot of process and procedures that we have to kind of follow when we do have restraints. And it's really hard for staff to keep track of everything that they have to do. So there was a restraint event checklist that was created by one of the units that we then shared in our newsletter to other members of the organization, should this be useful for them. Again, there was a transitions in care working group for inpatient handover. There was a paper copy that kind of or a T drive copy that was kind of used. So we wanted to see how we can put this into our documentation so that everyone can access it, everyone can edit and format it and modify it. And then bringing together all the different champions and all the different roles together to discuss what is needed, what is not needed, and again, led entirely by champions. Some others is expanding the program assistant roles in clinical units to kind of be more hands-on with the patients, kind of seeing how they can integrate their roles a little bit more in clinical areas. Streamlining the discharge process with the use of patient-oriented discharge summary, which is more of our outpatient goal right now. Streamlining the SBAR process between ED and other inpatient unit, which is a pilot project, and then optimizing documentation for Code Blue and external transfer, which is, again, something that we're working on right now. And lastly, just some of our lessons learned. Again, like I think we did try our best to share out of the box ideas, but I think we should have done a better effort in finding ways and finding a platform on how do we share the unique out of box ideas that some champions have with the rest of the other champions, so that it either encouraged them, but also just allows people to collaborate and talk about it. The way that we engage our champions is we kind of, from the start, we told them the 5 guidelines that we had, and we asked them to pick the guideline that they wish to champion. But we realized that, once we got through some of the guidelines, that not all guidelines were getting implemented everywhere. So now we're at this phase where we might have some, like, for example, a delirium champion in a forensic section, but we didn't start with forensics. So now this champion is feeling, okay, what am I going to do, or how am I going to get involved? So again, if we were to go back, perhaps we would have a different approach where we would go guideline to guideline to be like, hey, we're doing this guideline, who wants to champion it? This is the next guideline, who wants to champion that? So that at least we would be then asking for champions from those specific clinical areas. Engagement with new staff could have happened earlier, perhaps in clinical orientation, and perhaps more engagement with managers to make sure that they actually follow through with them doing the champion modules. More opportunities for internal knowledge exchange amongst the champions. So, every quarter, perhaps inviting all the champions, talk about the work that they've done. Though I would say that even though it's a lesson learned, it's really hard sometimes to organize these internal events because of staffing, scheduling, unable to come off the unit because of other clinical priorities that come. And you often don't want to have 5 people show up, right? Like it's really important to have more people present. So though this is, I think we now try to do this more so when Doris comes, or when we have our champion engagement sessions, and then better engagement of leaders. So though we have some of our leaders show up, which is really, really great, it would be great for external, like outside of PPO leaders to come to kind of hear the work that PPO is doing and the impact that they're making, perhaps in those leaders' clinical priorities, and how we're kind of working together and establishing some of our outcomes. And that is it. And sorry, Sharita, anything that you want to add that I've missed that you would like to share?
No, that was very comprehensive and thorough. Thank you, Saharish.
Okay.
Yes, thank you. Thank you, Sharis. Thank you, Sarita. Lots of great information on really how you're engaging your champions, and that's so important. And I know as you went through that, you're just so, thrilled with the engagement and the voice that the champions have and those ideas and such. And as you're really making an effort to be sure that that's being heard, it's wonderful. Is there any questions at all? That we are a little bit over time, but if there is any questions coming about in the chat, then we can take a quick moment to have those answered for you. Sharis, it really was a great presentation. I really appreciated your last slide on those lessons learned, and that's so important, right? To reflect back on that and everything. But and so much information ahead of that of how we can, as BPSO organizations, really, really engage our champions to be a part of the changes that are being made, because they are a big part of those changes, as you know. So I don't see any questions in the chat. Oh, I see lots of comments on a wonderful presentation, and I echo that. It was an absolute treat to have both of you here to share your experience and your expertise. And we just want to thank you for that. And thank you to everybody who took the time out on their lunch break today. And we hope that you have a good rest of your day. We're going to sign off now. Thank you, everyone.
Thank you so much.
Bye-bye now.
Take care.